And thank you so much for joining us here on Idaho Today. The holiday season, no surprise, but we all know it can bring on stress. Plus, it can disrupt sleeping patterns, can also cause poor diet, not to mention other factors that can all lead to greater heart risk. You know, a matter of fact, research by the American Heart Association shows that more Americans experience fatal heart attacks during the holiday season than any other time of the year. So in this week's Life in Balance, we spoke with Dr. Jeffrey Heslop. He's an interventional cardiologist at St. Al's, and he's at the Heart Institute. So we're going to learn about how common heart conditions can be and ways to treat them. What is atrial fibrillation?
Atrial fibrillation is an irregular, chaotic heart rhythm that causes the heart to race in many cases. And it's a very common condition. There's a lifetime risk for people in developing atrial fibrillation, about 25%. And about 12 million people have atrial fibrillation across the United States. When people develop atrial fibrillation, they might feel their heart race, they might feel winded or short of breath, or might have more mild symptoms, just feeling fatigued. Or sometimes people don't have any symptoms at all. The main goal when people develop atrial fibrillation, if we catch it early enough and they're having symptoms, we like to restore them back to a normal rhythm using medications and sometimes procedures. And if you've been in atrial fibrillation for a long period of time, we try to just slow the heart rate down so they're more comfortable. People who have atrial fibrillation are also at increased risk of stroke, and so we often place them on a blood thinner.
Okay, so if you do have AFib, then one of the first responses is for a blood thinner.
Yes, and I'll explain why that is. When people have atrial fibrillation, the top chambers are not contracting regularly like they should. And so blood can actually become very stagnant and pool. And there's a structure in the heart called the left atrial appendage that is where 90% of the strokes occur in somebody with atrial fibrillation. And so we're treating this small appendage with a blood thinner. Unfortunately, the blood becomes thin throughout the body.
Okay, so then there are some side effects then to being on a blood thinner.
Yes, the most common side effect is the increased risk of bleeding. For people who have had bleeding in the past or have falls or at risk for bleeding in other ways, some people have high-risk occupations where they are at risk for bleeding. We have alternative ways of dealing with that.
Okay, so what are some of those alternatives for those who have AFib but can't be on blood thinners?
Well, for people who are undergoing cardiac surgery, we often will, the surgeon will place a clip over the top of the left atrial appendage at the time of surgery. And for those who are not undergoing surgery, we deliver a device by less invasive means. So one of those devices we place at the front of it. It fits in here like this. It blocks off the left atrial appendage so that there's no chance for the clot to escape and cause a stroke in the brain.
Oh, wow.
And here's a different version of that called the amulet device. And these devices are both FDA approved. This is the Watchman device. And they block off the appendage so strokes don't occur.
Oh my goodness. Okay, so this is amazing on how this procedure actually works.
Yeah, it's a 30-minute procedure. We usually get access to the vein near the hip bone and deliver the device, and people usually go home the same day.
You really?
Yes.
The same day? So you're not cutting open a chest, you're going in through the cardiovascular system and kind of weaving your way up to the heart to insert that.
Yes.
Wow, that's amazing.
Yeah.
Okay, I imagine this is some incredible news for those who have AFib and may need to look at other options beside blood thinners as well. Where can people go to learn more?
They can go to the structural heart page at stalphonsus.org.
Wonderful, thank you so much.
Thanks for having me.